everyone, and welcome to this episode of Soulfire Spirit. With me today is Kate Cunningham, who is a dear friend of mine, and we are here to talk about all things in between our generation and the ones around us, our kids, our parents, our families, life, jobs, all kinds of responsibilities. But Kate, before we get started with this series, since this one is going to introduce what we'll be talking about many, many times moving forward, why don't you share a little bit about yourself?
A, a mom, a wife, a daughter, a granddaughter, a goddaughter, a cousin, a nurse. I'm a lot of things. I think what really sparked my interest in talking to you about these topics is how much we have found there needs to be a space for this type of conversation because it's such a common experience, even though your lives can be completely different and what you specialize in, what you do for a living can be completely different between the you and I. What we do every day for work is very, very different, but it collides on some really common paths, right? It doesn't matter what you do from 9 to 5. Most people have these common areas like parents and kids and jobs and life. And so that's a little bit about me, sort of. Me being a nurse plays into what we talk about because I have a little bit more of a front row seat than a lot of folks as far as, the older generation or the boomers or whatever you want to call them, aging and having folks our age have to deal with, oh God, what do I do? And they're all doing it at the same time with the same resources or the same lack of resources. And I find myself in this conversation so often as far as people with questions, and just because they know what I do and they have, they're dealing with things for the first time. And I find a lot of the same conversations coming out where it's like, yeah, this sucks and no one's talking about it. So I think that's what made us, or me in particular, really interested in doing this with you, is just opening up a conversation that I know a lot of people want to hear.
Oh, absolutely. And I think what brought us together, because you're right, our careers are night and day in different ways, but it's the humanity and our human experiences where there's a lot of overlap, and that you and I are very transparent and we'll talk about anything. We're not afraid to talk about anything. And that combined with some of the circumstantial stuff that's happening within our families or with our friends, and then with work where we do overlap in certain spaces, and just the topics that keep coming up. And in the course of these private conversations that you and I have had over the past year, really, recording them now and sharing it out with the world, I really do believe that it's going to be beneficial for other people to hear it, because they might feel like, oh, I didn't think about that. But that raises about 500 other questions in life. Or, I didn't have anyone that I could talk to about it because I couldn't articulate XYZ. And we'll cover those topics because a lot of the things that we talk about, as you said, like being wife, mom, daughter, granddaughter, goddaughter, aunt, fill in the numerous, blanks. We deal with a lot of things day in, day out. And just by speaking about some of these things out loud that might be difficult or painful, or just happy anecdotes about life along the way, or humorous, it's what makes us us. And every single human out there, every person is dealing with something like that. We have good days, we've got bad days, because we are human. So if we can break down and demystify some of these scarier topics or things that people don't want to talk about or didn't think about talking about ever, at least we're helping to create this positive ripple, as I like to say, within our communities and within our family and friends. And it might prompt them to open up and ask questions or seek the answers that they need through their resources around them. I'm really looking forward to these conversations that you and I are about to have.
Yes, I am also. I think, it's I like your word transparent in our conversations. And I think it's nicer than what was probably closer to the truth for me, which is blunt. And I tend to I'm not somebody who just is like, well, I say what I say and, take it or leave it. I think I find that pretty off-putting, but I really work to strip back some of the layers of nuance that especially people that work in healthcare and in the world of healthcare do, where either there's just language barrier as far as, it's just use regular words to tell me what's going on here, but also like the implications that happens, whether it is something like, oh, I don't know if living at home is going to work for your mom anymore from a healthcare person, when really what they should say is, this isn't safe and we both know it. What are we going to do? That kind of hanging ... And, all the way up until we're out of treatment options, when what they really should say is, you're about to die. And I'm somebody who I really pride myself on, I will say the latter. I'll say it kindly. I'll say it with space. I'll say it while we answer questions. But some things need to be said that aren't being said. And so that is part of my mission and my passion in what I do, is to, with kindness and with caring and with understanding that all of life happens to us on an individual basis. So there is no rule book and there is no step-by-step, even though sometimes we desperately wish there was. Some things are unavoidable and we do a darn good job of trying. And so I really focus on, I think the truth is important. And I think there are more people out there seeking people who will just say, could you skip to the part where, what do I do next for my mom? What do I do next for my grandma or my dad or my spouse or my child, or, somebody in the situation maybe doesn't want to read 3 chapters of your beautiful backstory of your opinion of things, but wants the step-by-steps, wants you to learn their scenario and be like, ooh, your options are limited, but let's go through them. So that's part of my hope as well. And then in talking to you throughout this, it's just been a good back and forth of, I think we both have similar approaches to the world in that stance, but different experiences also.
Completely.
So I'm excited for that. Mm-hmm.
And it's the caring component of all of this, because you can be very transparent and truthful in how you're communicating something, but knowing how someone's going to receive that language, especially as a nurse or a healthcare provider, but being open. And this is the part where I'm just going to straight out say what's going through my head right now. And you already know this because we've talked about it, but for everyone else out there, my cancer diagnosis, I have a doctor who doesn't use the C word, because that C word,
Not the
cancer.
other word. Just to clarify.
Like I had to say cancer. So it's that word. And to this day, she doesn't use it. She will give me my diagnosis. She will use the big long word that nobody understands when I say it to them, of like, oh, this is what I have. And everyone's like, I've never heard of that. What is it? Okay. It's this very short term. But the point is, because people or patients are scared of that word.
Yeah.
Doctors have learned not to say it because it might trigger somebody, when the truth is, for me, tell it to me like it is.
Yeah.
How much longer do I have to live? What else is going to go on? What can I expect for myself? And what are all of my options for treatment out there? Or I don't have options, but give it to me straight. And don't say, well, let's try this for a few months and let's see how things are going to go along the way. And then I think, well, things might get better, but they really don't. But no one told me what to expect otherwise. But I do have a bunch of website links where that they've given to me, that I can go research more about generalized information that isn't going to help me any in my particular case. So communicating with care is what's needed in healthcare, but more importantly, with what we're doing through all of this, I experience that of you every single time I talk to you. And yes, you can be blunt, but blunt has a negative connotation to it.
Right.
Kate is open and communicative. And I love that about Kate. So I want the world to experience Kate.
Well, I don't know about the world. Let's see how the first few times feel about Kate before we get too excited. But I can't tell you, when you first told me that story of your doctor, who, by the way, is an oncologist. That is a person who specializes in the C word, cancer, not the other one. But I think that lives rent free in my brain. If I could tell you how many times a day or a week, I just think it blows my mind. And I think what I worry about the most is the blanket application of that, where for every person who walks through this door, whether you had fear or not, I'm going to assume you do. Or if it isn't that, then that doctor not articulating why you can't say cancer, if it isn't fear, if you don't tell people what's going on, whether it's your health or anything, it could be your relationship, it could be, there's nothing I think that this doesn't apply to. If you is assume the worst possible assumption, and that's just human nature, especially in a place like an oncologist's office, where out of some sense of protection, it is, well, we don't need to say that word. And it brings me back to something I train nurses occasionally, and not occasionally, pretty frequently. And one of the things I always say to people that are new to what I do is I really encourage them. The first question I want you to ask yourself when you're in one of those scenarios is, are you uncomfortable, or is the person you're looking at uncomfortable? Because both can be true, but one can be true and it can just be you and the person is fine. And then I don't want to treat that person based on your discomfort. And so that needs to be question one. Who's the uncomfortable one? And sometimes it's both, right? Because I think that's the dirty little secret of healthcare too, is everyone assumes that everybody, you go in and you get this basic credibility being a healthcare worker, where you're like, the patient is like, well, they're fine, I'm nervous. But there are definitely things that we see where it's like, oh, hi, wow, that's a lot. And rather than pretending those aren't true, just acknowledging them. And the people who I find to be, and there's plenty of people who practice this way, who are just human and genuine and are like, holy shit, I can't believe this is going on, are the ones whose patients feel the safest and the least scared. And, versus those ones who give this aura of like, you don't need to know, I've got it, I'll handle this, little lady, you go sit down kind of healthcare, is so frustrating, because we have this little thing called Google. So people are going to go down 10 different rabbit holes and find the worst possible conclusions, where you could have just owned that moment and said, even if you're saying, I don't know what this is what I've seen before, this is what is possible, this is what we can control, and we're going to take the next right step until we figure out where we're going. 9 people out of 10 would rather hear that than, don't worry about it, I'll see you in 6 weeks. And that's where, when you told me that story, it blows my mind. And it's the blanket approach. If there's somebody who's just crushed under their diagnosis and they can't hear that word, I love that you have that space. Great. But to just assume no one can hear it and no one wants to just be dealt with straight, oh, that's frustrating.
Well, and what you just said literally just happened at my last visit. Because we're talking now about medication and treatment for that. There is no treatment, there is no cure. But there's a medication that can help with some of the symptoms, but all the side effects of it are all the side effects I already have. And then there's a whole bunch of really disgusting side effects that I don't want to have. So the question is, how much can I deal with on a daily basis? And what's my tolerance level of what I currently go through? But the conversation with the doctor on something like this, the symptoms since my last visit have been really, really, really bad. And I have this, and this, and it's intolerable. She's like, then it's time to start this medication that I know you don't want to take. And I stopped, like I held my breath. I'm like, I don't want it. I really don't want to go down that path, because once you start, you can't stop. And that means the rest of my life is going to be on that medication. And she's like, what's really in your space that you don't want to take it? And I said, and I explained the side effect. And her response was, well, okay, but I have all these other patients and we're only starting you at a baby dose of it. So it's going to be fine. And I kind of just let the conversation go because I'm like, I'm not going to win this. And then I said, you know what? Call in the prescription. Fine.
Mhm.
I came home, and instead of Google, I have a sister who used to be a pharmaceutical sales rep. She
Oof.
knows all the ins and outs of every medication that has ever existed, along with what's coming on the market. She watches all of that and knows it inside out. So I called her up and I'm like, I need your help.
Mhm.
Here's the med. What can you find for me? And
Mhm.
because anyway, she knows all kinds of things. And she came back with her guidance on, I got more from her than
Then
I
you're
did from my oncologist. And it gave me, or empowered me, enabled me to make a decision about, do I want to take it or don't I? And the answer was, I don't.
Mhm.
I'd rather not.
Yeah.
And I might not ever take it, no matter how bad my symptoms get, because the side effects really aren't worth it to me
Right.
for one reason or another. And all the clinical studies that have been done and whatever, and how many people are in those clinical studies, and why was this med created in the first place? Just
Yeah.
like, is it the Ozempic thing
Oh,
that wasn't for losing weight, but now everyone's taking it, and now all of a sudden there's a whole bunch of side effects. So
we did a group of study with 35 people. What could go wrong?
exactly.
Yeah.
So anyway, that was one thing. And then as you were talking, I was watching a Wanda Sykes special.
Mhm.
She's for those of you who don't know her, she's a famous comedian, very funny and very tell it like it is.
Yeah.
And her more recent one included a skit about a trip to the OBGYN.
Mhm.
And similar to my experience, because at one point it was, we're the experts, and
Mhm.
they share your test results with you. They examine you. It's incredibly embarrassing, humiliating, and uncomfortable for everyone who doesn't go through what they do all day long, every day. For the
Right.
rest of us, it's once a year.
Right.
And I'm 45. I haven't gotten over that. It's still
Yeah.
going and going through
Today's
it.
my birthday. Yeah.
So, but now it's like they pulled all the OBGYNs aside and taught them, like, hey, you need to talk about real life human stuff. So it's not just a come in, do the exam, and send them out.
Right.
So my last OBGYN exam was, while we're going through all of this, we're talking about Thanksgiving dinner and what is going on with her
Mhm.
and with me, and what are
Mhm.
our plans. And a random person who was assisting, who's not a medical assistant, but was in the room too, which
Feels
this
great.
isn't the first time that this has happened. It's very
Yeah.
weird to me.
Uh-huh.
But what is wrong with healthcare where they're forgetting the human and the
Yes.
human experience? And what you said was so profound, in that as a patient, we're going to a doctor because the doctor has a medical degree, and we've
Mhm.
been trained that we have to go for physicals, we have to take care of our health and take care of ourselves. As a
Mhm.
patient, I'm not thinking about what the doctor is experiencing and that they might be uncomfortable, because if they're uncomfortable, I have more questions.
Right. Yep.
So anyway, I'm so happy that you said that, because it's enlightening on both sides, patient side and the provider's side, because as a patient, we don't think about what our doctors or nurses are going through. So
Mhm.
thank you for
Yeah.
saying
I think the Thanksgiving dinner topic conversation is one, my new favorite bit of information about you. And two, like, I think it's really, when you say, I don't know what happened to our healthcare professionals, it's what happened to healthcare, right? And it happened in the OBGYN's office, in the primary care office, it happened in the hospitals, and it happened slow, and it happened quietly, and it's still happening. And I don't think most people in healthcare don't know it or feel it, but all of their spidey senses can kind of feel it. And and this is a whole rabbit hole that I promise we won't go all the way down, but it's profit driven care, right?
that.
There is no space in any of those systems for you to talk to the person in front of you, or the cervix in front of you, or the oncology patient in front of you. It is literally the wrong thing to do in almost every healthcare setting right now, to say, how are you and what do you want? those are wrong questions. And I think most healthcare professionals would kind of take a deep breath and look back at that. But then if you really look at your day to day, if you are a healthcare professional, or if you know someone, if you look at it and you work in a hospital system, you work in a doctor's office, we don't ask those questions, and we don't ask them anymore for a very specific reason. And it's because the answers are individual and long and complicated, and they slow down care. And when you have to bill every visit to United standards to get your decreased premium back, you don't have time. And it's not like one day they came in and said, no more of that, and we're the big, bad, evil healthcare profiteers. It very slowly and incrementally happened, where they didn't even say it. But what happened was the expectations got bigger, the time got shorter, the productivity went higher. And what is the only thing that can be plucked out of there? It can't be, what did you prescribe? It can't be, what did you diagnose? But it can be, how are you and what do you want? And so now, and it is so prevalent everywhere you go, there are only a few spaces left in healthcare where it's the right thing to do to stop and look at your patient and start with, how are you and what do you want? And they're so simple, but that's how you get to know your person. You get to know the problem, all of those things. But in profit-driven care, which unfortunately all of America is, it's the wrong question, because it won't get you to that next visit. And that's where everything is driven quietly and slowly. And it snuck up on a lot of healthcare people. And you see where there's this huge influx of people leaving. And it's for that, like all these things that we use. A lot of people came in thinking, this is going to be my passion and my career, and I want to do this. I want to take care of people. Come, and they did it. And they feel like a cog, because they are. And that you can't quite put your finger on it when you're in the middle of it. But if you are lucky enough to find a space where you can get out of it in healthcare, or if you just leave healthcare altogether, then healthcare stays the problem. And nobody says out loud, the problem is healthcare is not for people, it's for money. And that's where everybody gets stuck. And I don't want to take it in down. We could probably make a whole series about how I feel about that. But what it has done to the human part of what we're supposed to be doing, and the shortage of people willing to do the healthcare part, because it's just as fun on the other side to have finished your entire day and look back and think, I looked at 15 cervixes today. Cervici. Now it doesn't sound like a word. You know what I mean?
I don't know. We're gonna have to look that up. I only have one. I didn't know
lower.
Plural was.
But I didn't look into anybody's eyes. And I promise you, there are people who feel that way at the end of their day. Mm-hmm. I would look to be something else too. And we're going to run out of people who are willing to just show up and check the boxes.
And what you were talking about just now, to me, the PCP, so primary care physician, for my friends who are abroad, not in the US, our primary care physicians used to be the family doctor or the internal doctor. Like you would go see them and they would send you to a specialist, which kind of still happens, but now our specialists can override whatever the primary care does.
We never talk again now. Yeah.
And the primary care, we could go see them. And the question, at least in my experience, has been, hi, okay, you came in 6 months ago. What's changed since then? I see this on your record and this on your record. Okay, what medications need renewal? Mm-hmm. Every time, every single time. It's not about the person. And had those questions been asked of me, with all the other specialists and my other primary care doctors in the past, I'm not going to say how many years, but years, right? Yeah. They would have caught cancer while the symptoms would have still been manageable. And I felt like I wasn't heard going from one doctor to the next, because they only looked at whatever brought me into the office. And, or if it was a routine physical, my last physical, I will say this, my last physical, I went in, I was weighed. There was no check of my heart. There was no conversation about anything else other than you need to get your blood test drawn. And what meds do you need? So one gap after another, to the point where I wrote down my entire health history from childhood through adulthood. And I took it then to every specialist, and the specialist didn't want it because it wasn't coming from a doctor. And I'm like, but my doctors don't know, and
And I
they
don't know.
aren't listening to
Yeah.
me. So it's been a frustrating journey, but I want to dial back. Like, okay, for everyone who's watching, we're going to be
Yeah.
talking about healthcare,
Mhm.
because me personally, of what I'm going through, Kate and her career, there's this, the two sides of the story can be told. And then also, though, there's so much more to this because our personal experiences, we're human.
Yeah.
Yes, mom, career woman, wife, and all the other titles that we have. But as humans, what are we, Kate and Andrea, going through? And I would like, if you feel comfortable sharing, you shared a little story with me, a mini story before we started recording, but it sets it sets the stage and context of who Kate is and
Yeah.
where your family came from,
Mhm.
but it sparks more intrigue as well around how you see the world. So would you
Mhm.
mind sharing that little
Sure.
story?
Sure. Yeah. So I live in Colorado, but I live within driving distance of CU Boulder, and I have my entire life, and I have never once been allowed to cheer for CU or Colorado in any way because my dad is from Nebraska. And so that means from birth you cheer for the Huskers, and that's just your birthright and your job, and so you just dutifully go Big Red, right? So this weekend I have one sister who lives in Nebraska, not in the little town that my dad was from, but about an hour and a half from there. So I was going out to, my dad has passed away. He's been gone for 15 years, which is a story for another episode. But my sister, I was going out to visit her this weekend, and I took a trip to my dad's hometown, which is not on the way to anywhere. So if you weren't meaning to go there, you've never driven by there, I guess it's probably the best way to say it. And the sign for it, it's called Greeley, Nebraska. And the sign on the outside of town says, it has like, you're entering this village. It's not a city or a town, it's a village. It says 482 people and a few old crabs on the sign for the town, which is very accurate. But of those people, I'm still related to, probably a good 200 of them in a removed fashion, but there's a lot of history for my family in that town. And, Andrea doesn't have as much experience, if any, in the rural part of and I spent a lot of time as a kid driving back and forth from Colorado to spend time in this little town that my dad is from. And driving back this weekend, I went about 45 minutes an hour on the highway, 2-lane highway, going through the sand hills of Nebraska before I saw another car. One, because it was early in the morning, and two, because there just aren't that many people out there. But when you get into the county and you start passing cars, the rule is, if you're not completely foreign, that as you're driving, as a car comes up, you have your hand on your steering wheel and you give the little one finger wave. That's the hi, how you doing? I'm from here. That's how they know. And so you start doing that, and then you get into town. And as a kid, we would get into town and just kind of fly out of the car and be feral children while we were visiting, and not really, touch base at grandma's house for food. But it didn't matter because the whole town was watching you. So if you got out of line, someone was going to call and they were going to know who you were, and you were going to get put back in line. And, and so that is a little bit of my roots as a person. But my grandfather it's Greeley, the village of Greeley, but also in Greeley County. He was the sheriff of Greeley County and also the mortician, and drove the ambulance, first ambulance, I think. And so my dad, being the oldest of their 10 kids, would be, in the 60s, 50s, you would take your kid with you, and they would be your non-paid help. And so, a lot of people went to the bank. My dad went to the morgue and to the jail and to the accident scenes and all kinds of things. And as a kid, those were the stories I heard, right? He was also a Vietnam vet and just a big personality, a big guy who had a lot of stories and a lot of time to tell them, and he rarely met somebody he didn't want to talk to about anything. And so my dinner table conversation growing up included death and dying and, harm and crime and industry. I mean, not interesting crime, right? It was Nebraska, but like, it wasn't, I never was raised with that fear of the conversation. The conversation was normal. And I think that I know that what has been something that's really shaped who I have become and how I'm able to do the work that I do and talk to people the way that I do, because I think it's what makes me feel secure, is that it was never sugar coated for me, and it was never hidden away like a big secret. And I think that experience, as a kid, they owned the mortuary. So if you were going back to grandma's, you were going to hit up at least one Catholic funeral, whether it was someone you knew or not, just to help hand out, pamphlets or brochures or fans. And that's not everybody's childhood. So death and dying, end of life, big, hard conversations, they come a little bit more naturally to me based on, some of my weird history.
I had no idea that your dad was one of 10.
Yeah.
My dad was one of 8.
There was a couple that were died in infancy, but
So same in my family, except my dad was one of 8, and there were a couple that were miscarried. So interesting, but that's also the reason. So my family too, very transparent. My dad, it was always straight. Like whatever was in his thoughts would come through the mouth, but there was no filter.
Nope.
He was like that at work. He was like that at his family. And that's how everybody knew him. My mom was the one who finessed things, but no topic was off the table there, except, there were certain things in family history, like skeletons in the closet, that my dad said, even before he passed, almost a year ago, before he passed. So he was 75. And he told me that I'm still too young to hear some of these things. But other than that, death and dying, he lost his parents when he was a teenager. So, and then he lost his brothers when he was still a young man or young adult. So for him, it was part of life. And there was nothing that shouldn't be talked about, because how do you plan if you don't actually discuss the hard things? And that was just normal. So, and in Europe, it's a very different lifestyle, it's a different upbringing than what we have in the United States. And for me, I'm the sandwich generation with my parents too, because they're immigrants. I'm first generation, but born and raised here. And my friends didn't talk about some of the stuff. Like there are taboo topics, and I didn't know there are taboo topics till I got older. But death and dying, it was always just part of life as much as birth was. Like you honor a person's life every step of the way. It's who we are. We talked about all of that stuff. And then for me separately, like my little tidbit or nugget of information for today's episode anyway, is more that I've also been speaking with the dead for as long as I can remember. And it's a gift, and whether people believe it or not, I'm not out there to convince anybody, and I'm not going to do that. It's just my normal. So for me, it's not this, it's over and it's devastating. And there's it's sad. Yes. I grieve my dad every day, my grandmother, and everyone else that I've lost this year, because there have been multiple, which is also unbelievable in its own weird way. But I can connect with people and I know what happens afterwards. So all of this, what you and I are talking about, even like I had a conversation with my son earlier today about college and what's happening. And then on the flip side, my sister, my brother, were planning on my dad's 1-year passing anniversary. Like life happens. And in this space that you and I have, where we're going to be sharing things, some of the things that we even talked about today, like, yeah, it's difficult moments that we go through. There's a levity even in the difficult moments. But like I have you, Kate, and it's awesome to be able to talk to you about some of these things. And then you're like, well, okay. And you keep me in check, or you would never say that you're keeping me in check.
Never.
We're far too kind, but it's this balance. It's this balance and conversation that we have that I cherish. And I look forward to other people tuning in and listening and hopefully getting some nugget that helps them move forward or just be. in their moment, that particular day. So if we're talking about kids or our parents or healthcare,
Mhm.
death, dying, the process, planning, we're living that every single day of our lives,
Mhm.
and everyone else's too. So it's time to start talking about it if people out there aren't.
Right.
There isn't anything that's too hard or too difficult.
Mm.
We're
I
human.
that's what you and I do best when we're together is take something that seems like, "Whew, how are you gonna tackle that?" And then you just remember, just because you can't tackle it doesn't mean you shouldn't talk about it, right? Because you can't make it feel good doesn't mean you shouldn't talk about it, because it's not gonna stop it from happening, whether it's from, death and dying to we're far from that, but what is an assisted living? When do we go to the doctor? What doctor do we go to? When is it okay to think, oh, I don't like that doctor, and when do you have to stop and listen even if you don't like what you heard? And to be able to, I would love, I think we will create a space where you can ask some of those things and get just an honest, blunt, transparent answer with hopefully some fun and levity and minimal C words and just to put it out there and have a safe space to just, there's so many people going through similar things and so few people focused on just that we're all people going through things.
We're human, and it's okay to be human.
Yeah.
Like, it's crazy to have to say that out loud, but it's true. We don't give ourselves the space and grace. And if we don't do that for ourselves, we can't do that for those around us. And the scary things will remain scary.
Mhm.
Maybe things that need to be talked about will remain untalked about. And then one day will come where you have to deal with the things that weren't spoken about. And then
Mhm.
it's super extra hard.
Yeah.
So we'll start covering some of the topics
Mhm.
just through the course of our conversation that talks about this in between generation that we're in
Mhm.
and what our experiences are. And like you mentioned, people will be able to ask, and hopefully we'll be able to respond live in some future, not recordings, but live sessions that we'll do.
Mhm.
Um, and I look forward to that and to every conversation that we have here and privately too.
Always. Yes, absolutely. Thank you so much, Andrea. It's always a pleasure here and privately.
Likewise. So thank you everyone for joining us today. Thank you, Kate. I look forward to the next time that we get to talk. I appreciate you. I appreciate your time.
We'll see you next time.